Baik, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi, warga NIH yang saya hormati sekalian. Selamat datang ke program Continuous Medical Education CME bagi bulan Mac 2021. Dan untuk makluman tuan-tuan dan perempuan, program ini disiarkan secara langsung di NIH YouTube dan saya minta sekiranya tuan-tuan dan perempuan sudi untuk like and share dan juga subscribe channel kita, support channel kita. Dan pagi ini kita akan bersama-sama dengan Puan Komathi Perialathan, Health Education Officer dari Institute for Health Behavioural Research atau IPTK, dan beliau akan membentangkan tajuk Addressing COVID-19 with Health Literacy. So, Puan Komathi boleh dengar saya?
Boleh.
Ya, selamat pagi Puan. Apa khabar?
Selamat pagi, Cica.
Baik, sihat lah ini?
Sihat.
Alhamdulillah, sihat. Okey. Baik, untuk tidak melengahkan masa, saya dengan ini menjemput Puan Komathi untuk memulakan sesi pembentangan dengan tajuknya Addressing COVID-19 with Health Literacy. Silakan Puan.
Okey, terima kasih kepada Encik Shah. And then good morning. Saya minta izin untuk present my slide dalam bahasa Inggeris ya. Okay, so good morning to everyone. Hi, I'm Komathi. As I think Shisha already introduced me just now. Okay, I'm from Institute for Health Behavioural Research, NIH, and I'm a health education officer. So today, without further ado, I would like to present my CME entitled Addressing COVID-19 with Health Literacy. Okay. Okay. So thank you for joining me for this CME session. Okay. So I would like to share an intro first. COVID-19 pandemic has been one of the greatest challenges for healthcare systems and public health reforms globally in many aspects: economic, political, social, health, and so on. So the pandemic actually has required us to adapt to new norms and change the way we lived before this. And then I would say that basically most of us, it may have affected us both physically and mentally. And with all this following of social norms and then a change of livelihood, the way we go to work and then household, and how we were asked to be stayed at home for most of the time during last year. And then like we have to follow the social distancing rules. So basically it has affected us. So therefore, I feel that health literacy might help people to grasp the reasons behind these recommendations, the reasons for them to follow the advised precaution measure, and it will help them to reflect on outcomes of their various possible actions. If they follow the precaution measures, what will happen to them? And if they don't follow, what will transpire? Okay, applying health literacy to address the pandemic is very important to slow down the spread of the virus, prevention of the disease, and in recently, the uptake of the vaccine for betterment of everyone. Okay, this is COVID-19 virus in Malaysia. I'm aware, I'm sure everybody's aware what happened, how COVID-19 first started early of last year, and how we were very successful in managing to contain it during in June, July, and we were able to a certain extent go to normal lifestyle with the application of new norms. But then after the election, the cases exploded, first in Sabah, then in Selangor, until now. The cases are still in 4 numbers. Previously, it was just like 2 numbers and became 1 number, the total number of cases, and now it's still in 4 numbers. But thank God, it has been decreasing from 4,000 cases something to now 1,000. The latest, like yesterday, is 1,360 cases, new cases. So basically, we are combating it, and there are a long way to go. And with this vaccine introduced for all of us, hopefully the uptake will be high and we can successfully create a herd immunity. And maybe after some time, we all can go back to the normal lifestyle that we all want to. Okay, basically measures taken by our government. Okay, these are the brief line on how the phases of the movement control order introduced in Malaysia. And apart from the placement of movement control order, our government also actually had various strategies to actually prevent this spread of COVID-19, whereby wearing of masks was made mandatory. Before this, there was so much issues earlier of the COVID-19. There was an issue on whether mask had to be wear all the time, who should wear it. But then further up, after some time, we started to learn more about this disease, whereby it was like made a must for all of us to wear masks, irrelevant of whether we are infected or we are not infected. But then there was like people who were like still arguing about it. So Malaysia has made a mandatory rule of mask wearing from last year August. And recently, even the violation of SOP, previously the fine was just 1,000, and basically people were still doing the violations, and now the fine has been increased to 10,000. So with this, I think the cases of SOP violations will be reduced. So we can see that our government has actually really taken a lot of effort and measures to actually contain this disease. Okay. So going back to health literacy. Okay, what is health literacy? Before I proceed, how health literacy and COVID-19 related? So I would like to actually go for the definition of health literacy. Okay, so I'll just say that it is a cognitive and social skills which determine the motivation ability of individuals to gain access, to understand, use information in ways which promote and maintain good health. Okay, so health literacy basically empowers people to make positive choices. Health literacy enables an individual to access, understand, evaluate, and apply health information for an informed health decision-making in their daily lives. Okay, health literacy indicates achievement, the level of knowledge, personal skills, and confidence to take action to improve personal and community health by changing personal lifestyles and living conditions. So actually, health literacy is just not being able to read pamphlets and make appointments, or read pamphlets and understand what the disease means, but it's beyond that, whereby there's different levels of health literacy. That is functional, interactive, or communicative, and critical health literacy. Okay. Functional health literacy. So when it comes to functional health literacy, it's the basic health literacy skills that everybody has actually. When they have a literacy rate and health literacy rate is different. Literacy is when we're able to read some information, we're able to read and understand what we read. But health literacy is beyond that. So when it comes to basic health literacy skills is that when it is sufficient for individuals to obtain relevant health information and apply that knowledge to a limited range of prescribed activities. I say that how to eat healthily, what are the diseases of, if we want to relate to COVID, they understand the basic disease of the COVID-19. How COVID-19 can be transmitted. So the basic understanding of a certain disease and what should be done. When we go to the communication interactive health literacy, it is the level where it is an advanced skills that enable an individual to extract information and derive meaning from different forms of communication, apply new information to changing circumstances, and interact with confidence with information providers such as healthcare professionals. When a person is actually the second level of health literacy, where it's a communication or interactive health literacy level, apart from assessing and able to understand informations that they assess, they will be able to make informed decision, and sometimes and they also will be able to discuss regarding health informations and decision making with their healthcare providers. And we go to the next level, critical health literacy level, whereby this is one step beyond the interactive health literacy level, whereby an individual will be more advanced, having cognitive skills to critically analyze information, to exert greater control over life events and situations through individual and collective action to address the social, economic, and environmental determinants. So when we talk about critical health literacy level, when I relate to COVID-19, of course, we will actually understand there were a lot of misinformations and infodemic going on related to COVID-19. So when people and a person with a critical health literacy level, they'll be able to actually analyze the information that they receive, and then they will know whether this is actually something they have to believe, or they'll go and check for the sources where the information comes, and they'll go for the relevant or safe sources to believe the information that they receive. And they will actually think whether they want to share the information or counter check first whether it's really, and then apart from that, they also actually, rather than just focusing on their self-improvement, in the sense like, okay, I should practice the precaution measures because it's important for me, they also actually have one step higher, where they'll be thinking of actually the COVID-19 precaution measures actually not applicable for me also, but when I practice and everyone practice, it will actually create a good containment of the disease in the community level. So this is what we call like the levels, different levels of the health literacy. Okay, this is actually the health literacy level among nations, whereby we during the National Health Mobility Survey in 2019, we had this health literacy module under the non-communicable disease. So basically, the survey showed us that overall in Malaysia, actually 40.7% of Malaysians have sufficient health literacy level. 35.1% of Malaysians have low health literacy level, and only 24.2% of Malaysians have high literacy level. So basically, the prevalence of the limited health literacy level is comparable to other countries, as what has been stated in these slides. Okay, so what does this mean? Okay, so to make it in a layman term, 1 in 3 Malaysian adults have low health literacy level. Okay, so what does happens when we have this low health literacy level? Okay, actually, the individuals who fall into the low health literacy levels may face difficulties in understanding and act on medical or clinical information and instruction, and they may have faced difficulties in getting updates on health promotion practice, healthy lifestyle, and they have difficulties in seeking, understanding, and take action to protect themselves against health risk factors, which is very pertinent to the current COVID-19 pandemic, whereby they have to be able to understand what is going on, how important it is for them to apply the precaution measures, and how important for them to understand the disease, how it actually transmitted, how it works, and what is their role to actually contain the disease. So when we talk about low health literacy level, the effects are major, and it can affect the health of the individual and in overall health of the society. Okay, so when we talk about going back to again health risk level among Malaysians, okay, so basically from the survey, who are having who falls under the low health literacy level, okay, higher proportion of the low health literacy level were among the rural dwellers, elderly aged 60 years and above, individuals with lower education, having low income group, and they are unemployed. Okay, so actually past surveys, past studies do shows that health literacy level is very high, related to the social disparities, whereby having a lower socio-economic background actually do affects their health literacy level. Okay, and we also say that, okay, when we see about the findings, only 1 in 3 Malaysians having low health literacy level. So we may think like, okay, 1 in 3 only, so it's not a big deal. And then we can see that, oh, okay, most Malaysians, 41%, have sufficient health literacy level. But when we do the analysis of the average score that actually in the study, the average score of our population is 35.5. Means there's like certain markings of the score basically on the based on the questionnaires that we actually distributed to our Malaysians, to the respondents. So basically score is 35.5, which each indicates that lower end of the sufficient level. This means those we have even though they fall under the sufficient health literacy level, but the score is actually showing that they are in the lower end of the sufficient health literacy level. So this means those who falls under the sufficient, even though we feel that they are having sufficient health literacy level, but they may struggle in comprehending or interpreting higher level of health information, texts, and materials. Okay, so how does low health literacy affects us? Okay, so from this diagram, you can see that actually low health literacy will affect in every way when we want to, when an individual want to access and reach out to the healthcare. In the sense like seeking support, they will have difficulties to navigate to the health system. They will have difficulties to understand the medical instructions. They will have difficulties to understand what it means, what is the importance of practicing certain health behaviors, and even lower health literacy level are attributed to higher hospitalization rates and higher morbidity rates and overall low poor health quality. Okay, so effects of low health literacy. Generally, when we have low health literacy, misinformation, limited health literacy, or low health literacy are major obstacles to health. Okay, so inaccurate information, myths about the disease, and important health information that is not clear and simple to understand do not help in this situation. So when we have low health literacy, when we receive inaccurate informations, and a lot of myths about the disease, currently we have a lot of myths about the vaccine. So basically, people with lower health literacy may have difficulties in digesting which is the accurate information and not accurate information, and will be actually affect their decision making regarding their health. So without good health literacy, people are not able to effectively differentiate between fact and fiction and can allow unreliable information to influence their behaviors. So basically, this can be harmful not only to the individual but to the society as well, because when addressing a major public threat issue like COVID-19, people with informed decision makings are very important. Okay, so research has shown that low or non-literate individuals are less responsive to the health education, less likely to use the disease prevention services, and less likely to successfully manage chronic disease, or now in this case, communicable disease, than literate citizens. Okay, so basically now I would like to move on to actually what are the challenges that we do face when it comes to COVID-19 in the sense of communication behavior issues pertaining to this disease. Okay, first of all, I would like to explain on challenges in understanding what is COVID-19. Okay, so lack of health literacy or the way the information presented may prevent people from having a good understanding of the novel coronavirus, whereby when an individual have low health literacy, they may have difficulties in understanding how the disease works. Okay, so there will be the confusions about the disease itself, how it transmitted, symptoms, and ever mutating variants of virus, vital precaution measures to take, where and when, how to associate the graphs among many aspects of health information that certain group of people still have issues understanding it. Of course, daily we are updated with a lot of information of the disease, and even like there's a lot of scientific evidence shows that how the virus mutates. There were different name for the mutating virus, and how from a basic three symptoms, now the symptoms of COVID-19 has been evolving, and how important for us to practice the precaution measures. And one of the main questions usually we were asked is like, okay, since I've already taken vaccine, do I still have to follow the precaution measures like wearing of masks and social distancing? Whereby the answer is yes. So basically, the information about COVID-19 is evolving, and we have a lot of graphs being shown to us. All these are not graphs, logarithmic scale graphs, and like people are actually lot of informations are given to people through all various medium channels, especially through the social media. But we can't say that everybody can 100% understand the information that we are providing them. Okay, so although people may access health information on the internet, TV or radio, however, there were a lot of questions pertaining to these diseases and that could not be addressed to this media of information. Yeah, we were given the information through the social media. We are supposed to read and understand it and act accordingly to it. But in case there's questions that we don't understand, we would want to have more clarifications pertaining to it, especially people with the low health literacy skills. The medium could not be able to give the answers to them right away at the moment, unless they can go and seek a healthcare providers to have a face-to-face information. So in some information, technical jargon and terms may be used, and they may even scare people who are seeking information trying to understand more about the disease. And sometimes we think that, okay, so these issues are only for lower health literacy level people, higher health literacy people should be able to understand what you're giving to them. No, actually we can't say that, because sometimes people with high literacy level also may have may have difficulties to comprehend complex health informations. So what we can say that vulnerable populations may not have the necessary language and literacy skills to understand and properly respond to the pandemic messaging. So basically, when we think that, okay, giving informations, overload of informations through the social media will be able to comprehend and contain and help to disseminate the information to public, not necessarily, because not everybody have the capacity to access to this media, capacity to have a smartphone to access to the information given through the smartphone. Basically, and this basically happens in places which were very rural with telecommunication issues. People elderly were not very comfortable using the handphone. So actually, basically, there are a lot of issues where we can't actually disseminate health informations for people's understanding through one medium, but actually we have to find ways to actually target the literacy level, target the population through strategic ways and understand the target group, understand their needs, and basically plan our communication strategies of health education based on their literacy level and where based on their social locations, rural, urban, okay, literacy level in the sense like how's the education level, whether they understand, because most of our language usually will be in English or be, and most of our tools, our health education pamphlets or informations in the media are basically in the main language of Bahasa Malaysia and English. So not necessarily everybody can understand this. Okay, so from this, actually, what we can see that even though, as I said just now, high literacy rate people may not necessarily to understand the comprehend complex health informations. So studies do shows that people do have problems understanding the COVID-19 disease, even though they are actually in a higher level of socioeconomic level and may have higher level of literacy rate. And when we think about, okay, we should provide the maps to show people how the risk areas is and they should not go to these places to visit. Not necessarily everybody can understand the map, because a study by Utah University actually shows that through the online survey, it shows that people do have difficulties comprehending the COVID-19 maps, even though, and they don't, the main objective of the maps shown to the public to make them understand that how actually certain locations are highly risk for people to go, but basically it doesn't reach out to the targeted people, whereby they don't understand actually what the map says, and some of them don't understand even the how the map actually the risk factors of the disease based on the locations. And some even don't understand the logarithmic graphs which shows the infectious rate at a certain point of time, whereby through a social experiment to 200 people in another study in Yale University shows that basically the public don't understand, the respondents in that study don't understand how the logarithmic graph works, and they were more comfortable and able to understand in a very simple linear graph that shows the graph of cases every day. So this can show that sometimes we would like to share a lot of scientific evidence, and inevitably maybe we may tend to forget that not everybody can actually grasp the information that we are trying to give to the public. Okay, so apart from having issues understanding the messages that we provide, there is the challenges of infodemic. Okay, this is a new term where since the coronavirus outbreak, social media and the internet have been flooded with information and facts about COVID-19. This is made worse by the amount of misinformation, disinformation, false news circulating in social networks, which has resulted in much health anxiety and panic behavior. And sometimes even some of the messages are not true. Okay. Uncertainties about one's health give rise to a modern phenomenon known as an infodemic, whereby there were a lot of information given, and for this COVID-19 it happens, and a lot of informations half into the informations are true and some are not true, actually flooded the social media and everywhere, and people had difficulties grasping and understanding whether this is true and not true. Okay, so what we can say that is true information actually aids in the mitigation of this crisis. But when the false information happens to be influencing people, it can actually exacerbate the situations. So this condition is even made worse by inaccurate statistics, illness and treatment needs, and vital health information is not straightforward and easy to understand. Okay, so people who lack good health literacy are unable to distinguish between fact and fiction and are more likely to be influenced by unreliable facts. This actually can be detrimental to individuals as well as society in a whole. People's information sources may be dominated by false news and fear as a result of the uncertainties. And a lot of this information spreads so fast in the through various social media channels and WhatsApp, Twitter, Facebook, other social media platforms. So, according to a paper published by Institute of Strategic and International Studies in Malaysia, misinformation about Malaysia's COVID-19 outbreak primarily related to the government policy or intervention, as well as community dissemination of the virus. Okay, so basically the report states that majority of the case of the false news is basically about virus transmission, vaccine development and availability, how the disease spread in the community, public preparedness, how actually they use prominent actors to state something which is not true, and claims of death, which is like over exaggerating, and other aspects as well. So actually infodemic can cause major communication issues and major health and mental issues to the public. So basically these are some of the social media for fake news that was shared about vaccine, about the disease, and how the symptoms of the disease. So basically a person has to be health literate to understand whether this is true or not true. Okay. And currently, with the vaccine available, there are a lot of issues and myths about the vaccine as well, how actually affect people's uptake regarding this vaccine. So basically, we have a tough role here to actually clear people's misinformation regarding the vaccine and to increase the vaccine uptake among our community. Okay. So there were various myths came out about our vaccine, about the disease coronavirus itself. So actually, health organizations actually came out with a lot of infographics to clear these doubts regarding the vaccine. In our KKM also actually rolling out a lot of communication strategies to actually address these issues as well. Okay, so another behavior issues pertaining to COVID-19 is the challenges of free rider when it comes to practice of preventive measures. Who actually these free riders are? Okay, so the COVID-19 pandemic has resulted in many constraints and limitations in lifestyle, including physical distancing, wearing of masks, requirements to stay at home, screening, testing, and contact tracing, and travel restrictions. Okay, so basically we have been explained a lot regarding the science, why it's important to practice these preventive measures, why it's important to take the vaccine for the herd immunity. We were actually, science describes the importance of it. Science explains this. But then, even though a year has passed where we actually face this COVID-19 pandemic, there are still instances where individuals choose not to practice these precaution measures and take lightly things. Okay, why does this happen? Okay, so what we can see is that irrational behavior in non-compliance with COVID-19 prevention measures actually may be motivated by the misperception of the risk of the disease, perceiving the risk as perceiving themselves as having low risk of susceptibility to the disease, and having low perceptions to the threat or the severity of the disease, and other personal priorities. And also the free rider. What actually the free rider means? Okay. Free riders are a group of people who actually don't intend to practice what is preached, but they actually get the benefit when the overall community practice it. In a population, in a community, there will be group of individuals, the group of people who actually follow and abide to the rules that are being said to them. Example, when we relate to the free COVID-19 issues, there are many of us who actually follow obliging and follow diligently what government has actually told us to do. But there are some groups who don't actually follow this. Why? Because they feel that, okay, when the other, due to the reasons of misperceptions. So when most of the public populations in that group actually practice what is being preached, this specific group of free riders actually get benefits from that. So when most of us actually practice the good behavior of precaution measures, the cases are being lessened, the transmitted cases will be less, and the spread of infection will be reduced. So people who don't follow this, as we call the free riders, will actually get benefits from this. And same goes to the vaccine uptake. So when many of us actually, people were, people actually were having positive thoughts of the vaccine and go forward to take the vaccine, they will create the herd immunity, whereby people who actually hesitate and think a lot about taking vaccine will get the benefit of the herd immunity created by the people who have actually gone for the vaccine. So basically, if most of us don't fall into the free riders group, it's not an issue. But if majority start to be the free riders in a population, it will be a great challenge for the public health. It will be a public health threat. So when these free riders have better understanding or have a good health literacy, and regarding the disease, importance of the precaution measures, importance of the vaccine uptake, maybe they won't be the free riders. Maybe they'll be will take a better informed decision making regarding this health issues. Okay, so we can see here is like paper clippings, news on how Malaysians non-compliance increase the COVID-19 cases and fail SOP compliance, and how some people actually don't want freedom and feel that they have the right to choose what they want. So how actually we can improve health literacy? Okay, so first of all, we have to see that healthcare settings can help to strengthen the commitment to health literacy across the scope of operations. The healthcare setting can prioritize and integrate health literacy content into their planning, evaluation, communication, and in-patient care strategies. Hospitals, clinics can try to leverage therapeutic relationships whereby healthcare personnel who works in these settings can try to build a relationship in the sense like leverage the therapeutic relationship they have with the patients or public to inform and educate about this disease. Teachable moments should be identified to address misinformation pertaining to these diseases. When patients at waiting counter or upon consultations with the doctor, we can take the opportunity to educate or even pass health information to them, just educate how important for them to practice precaution measures continuously in a simple explanation or reading materials. With appropriate planning SOP in place, we can actually conduct this small-scale health education activities to our public, because not everybody, as I said earlier in my slides presentation, not everybody has access to the information that are provided to them in the social media, and some don't understand. So certain group of people who actually have lower health literacy may need like this one-to-one explanations to understand better about the disease. Okay. Second, the effort should be taken to understand and respond to public's unique health-related knowledge, belief, and literacy conditions, as I have mentioned in the slides earlier. So basically, not everybody in the same boat, the same level. So studies on social media feedback shows healthcare department institutions as well as healthcare providers are deemed to be the most trustworthy in regards to COVID-19 treatment and information provision. As we can see that our DG has gained a lot of trust in the public. So whatever DG says, public tend to actually appreciate and follow. So from this, we can see that how actually public view our healthcare setting. During this COVID-19, we can see how much they appreciate the frontliners, how much they appreciate the healthcare providers. So with this, we can actually use that capacity to actually use to educate our public Okay, because they have high regards to our healthcare people in healthcare setting. So based on this, healthcare providers can play their role by understanding public's knowledge level, belief system, engage in a discussion, use the opportunity to correct misinformations, to improve health literacy, and ultimately to improve their health. Okay, so if during this situations, so actually, healthcare providers can assess the health literacy level of an individual and what they can do and how targeted information should be given based on the literacy level. Okay, and we have to actually build and enhance partnerships with the communities. So basically, local public health departments should interact and strengthen relationships with diverse community organizations and open new opportunities for information exchange. Local organizations can be recruited to serve as direct sources of timely, accurate information, leveraging the existing relationship rapport with individuals and communities. So basically, the health information is not just health information dissemination is not just a role of health ministry or the multimedia communication ministry, but actually we can mobilize mobilize our community, especially all the rukun tetangga and community level organizations, approach the NGOs to help to disseminate information regarding this disease. Because sometimes the local level communities will be able to understand their community better than in the ministry level. Partnership between public and private healthcare. It is important for public and private health systems to work together. Evidence shows that collaborations between public and private healthcare organizations, especially at primary care level, identified benefits in the execution of population-based strategies, such as provision of population-based information, collection of individual-level data for surveillance, and dissemination of health education, health promotion messages. So at this current crisis, it's very vital for us at public health systems and private health systems to work together to combat this disease. And very important is to effectively communicate. So during an emergency, good communication is very important. Local health authorities must ensure that content is transmitted in native languages so that more residents can understand the messages. To clarify terminologies and latest scientific studies, communication techniques should use usage of layman language, clear infographics, storytelling, and metaphors that can be used to help educate informed public in a very easy way. Close collaboration should be done with journalists, social media influencers, and content producers to help to bridge the gap between health officials and the public. And we have to always provide consistent, concise, and convincing messages that may help to reduce public's anxiety, reduce the spread of false information, and encourage appropriate health prevention behaviors. So we can see that information communicated effectively will help public to understand better about the disease and to understand better to take informed decision making. So overall, I will say why health literacy is important, because it will help us to react proactively to pandemic situations like COVID-19. So health literacy is critical. It assists the general public in preventing the spread of infectious diseases, avoiding overreactions, eliminating carelessness, and adopting health protective behaviors. Adequate health literacy is essential to respond proactively to the COVID-19 pandemic, as it not only enables people to apply credible health information, but also motivates them to adopt health protective behavior. A health literate society is one with a population that will be aware of the severity of the situation, able to understand how to protect themselves and others. So, public health and risk communication have been an important part of government strategies for reducing the spread of COVID-19 pandemic worldwide. Amidst the issues of infodemic and misinformation, low uptake of vaccine and continuous practice of COVID-19 preventive behavior, government readiness and vigilance towards promoting health literacy is very important. When government and public health experts are transparent in providing emerging information about the COVID-19 in an effective and clear and simple way that can be easily understood, this can lead to the public making more informed behavioral decisions based on their critical health literacy. The responsibility of health literacy is everyone's. The government, health information providers, health professionals, the media, and the general public all have an important role to play to combat this pandemic and for overall betterment of the society. Thank you.
Baik, terima kasih kepada Puan Komathi atas pembentangan berkaitan dengan tajuk COVID-19 with literasi. Jadi tuan-tuan dan puan, sekiranya ada persoalan boleh dikemukakan. Dan begitu juga bagi mereka yang baru join kita di YouTube channel, selamat datang. Saya ucapkan, so sekiranya ada soalan boleh dikemukakan dan saya akan bacakan. Jadi di sini saya ada satu soalan dari peminat kita di YouTube. Peminat dia so. So soalannya adalah mungkin ada telah dijawab sebenarnya Dr. Komathi, tapi dari spesifik group untuk soalan ni, iaitu soalannya adalah what measures has been done to outreach this population who are in darkness and also those who are in the anti-vaccine group. Silakan Puan.
Syah, boleh ulang balik soalan tu?
Okey, soalan dia macam ni Puan. What measures has been done to outreach this population who are in darkness and also those who are in the anti-vaccine group?
Actually, basically apa yang saya dah terangkan tadi dalam my slide. Okay, pelbagai strategi telah diambil oleh our government, especially our government, to actually combat the misperceptions of public yang terhadap vaksin ni. Okay, a lot of informations being actually disseminated to the public, and then how to say, we have actually had medias helping us to promote and helping us to actually share good news about the vaccine uptake, and then even the promotion on vaccine actually kita sebenarnya share every day in the media, like in radio. Sometimes I hear people who have already got vaccinated, they'll share the experiencing the side effects are very minimal and they know have side effects, it's safe to take. So actually we are trying to reach to the public saying that, okay, don't worry about this vaccine, actually it is for good. So basically, apart from the media strategies, we also may have like after this coming up with like going to the public, reach out activities at the health centers, at the health facilities, at the local community centers. And we also actually had like open up centers in the community levels to come up to let people come abroad for the registration. And then apart from that, actually kalau nak katakan pergi dekat community level tu, kadang-kadang kita engage with the community head ke atau rukun tetangga ke untuk disseminate these activities relating to COVID-19 dan vaksin.
Ya betul Puan. Kalau kita lihat di radio, di television, even di social media, saya rasa saya berpandangan kerajaan, especially Kementerian Kesihatan Malaysia, telah menyebarluas pelbagai maklumat berkaitan dengan COVID-19 dan berkongsi statistik dan pada masa sama dari sudut pencegahan dan juga kebaikan vaksin COVID-19 ini. Jadi ada soalan lagi ke? Ikutkan? Ada. Baik, rasanya mungkin kita bagi 1 minit lagi, mungkin Puan Komathi boleh conclude sedikit lagi berkaitan dengan COVID-19 ini.
So sekarang ni dulu kalau nak tengok kita lihatkan isu kita berkaitan dengan pemahaman tentang penyakit tersebut dengan bagaimana kita nak apply the practice measure. Then masa kita talk about the disease, ramai yang ada tanya berkaitan dengan bila kalau kita dah ambil vaksin ni kena social distancing tak? So these are the concerns last time, but sekarang ni kita ada banyak isu pula berkaitan dengan vaksin. So basically kita pun sedang merangka pelbagai strategi dan sedang menyediakan pelbagai bahan komunikasi yang bersesuaian untuk menjadikan masyarakat lebih memahami tentang vaksin ni, dan we are trying our very best to alleviate all the myths and all the wrong perceptions related to the vaccine. So because we would want to reach the herd immunity level in the public, so that actually we're working very hard. So what I would advise is that when we talk about health literacy, I would suggest, and I would like would like to plead the public to actually read further, get information from atau dapatkan maklumat dari sumber yang sahih,
Ya,
And then
betul.
basically relate rujuk pada KKM punya website rather than kita baca apa yang dapat daripada WhatsApp ke, and then we also share without knowing it's true ke tak. So we have a lot of responsibilities, social responsibilities actually, to help overall betterment not only for ourselves tapi untuk public juga.
Ya, betul. Kalau dikatakan kita sebenarnya bersaing dengan misleading information about COVID-19. So we are competing with them yang menyebarluaskan misleading information on COVID. Banyak yang tidak baik dengan baiknya. Actually, it's good for everyone to have this COVID-19 vaccine. So sekejap saya lihat sekiranya ada soalan di YouTube. Okey, tiada. Nampaknya tiada soalan agaknya. Okey, terima kasih sekali lagi Puan Komathi atas perkongsian berkaitan dengan tajuk kita pada pagi ini, COVID-19 with health literacy. So saya berharap warga NIH, harap para penonton yang berada di YouTube channel dapat menyebarluaskan maklumat berkaitan dengan tajuk ini, tajuk pagi ini, dan jangan lupa like, subscribe dan share YouTube channel. Kita nak memeriahkan lagi YouTube channel kita, NIH YouTube channel. Dan untuk itu saya bagi pihak Rusti mengucapkan terima kasih kepada Puan Komathi sekali lagi atas presentation pagi ini. Very interesting topic. So untuk itu kita jumpa lagi insyaAllah pada CME yang akan datang. Assalamualaikum warahmatullahi wabarakatuh dan selamat pagi. #kita jaga kita. Don't forget that. Thank you. Bye.
Thank you, Joshua, and thank you to everyone for joining my CME sessions today. Thanks. Thank you. So I will take my okay, thank you. Thanks for